Able.
You guys?
Well, sort of. Fine. The only way to do that would be to just go ahead and phone me. Morning, sir.
Morning.
It's too bright. I'm gonna have to turn.
Turn it off.
Y'all face me. Hey, Jack.
I wonder if we're in airplane mode. It's increasing
Edward probably did the same thing.
the count. So it's like,
He told me, "Por otra hand, no sé."
Said it was going through.
You want to check my comments out whenever you have transfer later. Later. No, no me dan emails.
Yeah, that'll work. They're not going through.
Chief Mendez, what we'll do is after I speak on an open meeting, we'll have you give an update.
Are we ready? Yes, sir.
Good morning, everybody.
Good morning.
Thank you for being here at the regular meeting of South County Commissioners Court. It's a short agenda. It's March 23rd, 2020. I believe it's 10:18 a.m. We're at the LaSalle County Courthouse District Courtroom, 101 Courthouse Square in Cotulla. We have a full quorum. If we could rise to say the Pledge of Allegiance. We have a relatively short meeting. It is open for public discussion, but when we get to the declaration, you're also able to participate. Does anybody have any public comment? There being none, I'm going to go discussion and or possible action on disaster declaration resolution. Before we do, I'm going to have Chief Mendez, Daniel Mendez, give us an update. They've been very proactive in addressing community issues. You can come up here and have a seat.
Good morning, Commissioners. Just to give an update, we're getting a lot of information. It's changing hourly at this point. One of the things, we're in touch with Region 8 from Texas Department of State Health Services. We're working very well with them. So the state is updating every day at noon, total cases, anything that's going on. As of yesterday, the state update, there's 334 total cases in the state of Texas, and they had 5 deaths. Unfortunately, last night there was a death in Bexar County, so it should be up to 6. There are 69 cases pending county assignment. It will not let us know until noon today where those 69 additional cases are. I did bring some literature from a different site that we've been monitoring, and this breaks down the total cases in the United States as of this morning, along with deaths, recovery, active cases, closed cases, so forth. Here locally, after the judge issued the declaration last week, we began screening at the Lowe's here and the Family Dollar in Encinal, along with the courthouse all staff. Basic questions and temperature screen. This weekend, 7 screenings of individuals going into Lowe's. They did have high temperatures. Lowe's is restricting those people at this time from entering the facility, which is a very good practice. It could be hot outside, allergy, so forth, but without a test from their primary care physician, there's no way to tell what's going on. So we're here to educate the public and restrict kind of just in case. We have had some complaints about the screening process. Those complaints have mostly come from individuals from Laredo or the San Antonio area that were coming into Cotulla or Encinal. They were not exactly happy that we were screening because we're one of the only places that are screening before you go into a grocery store. they're saying, well, why isn't San Antonio doing it? Why isn't Laredo and you guys are? We're here to protect our community. With that, with the screening process, Lowe's is starting to get more food on their shelves. The stores here have that food to provide for our community. So I believe that's a very positive thing we have done here, especially to take care of our community. There are some restaurants and other eateries that weren't truly complying. We are working on that with education, letting them know kind of what the governor, what the CDC and everybody is saying. The fire department, we've done since last Friday morning, 40 different screenings, events, which means I know at the Inchinal Detention Facility, the jail here, if somebody gets arrested, Lowe's, we've been getting calls, so it's picking up. At this time, we're going to see a case. I wholeheartedly believe we're going to start seeing cases in LaSalle County. It is moving, but what we're doing is trying to slow it down and do our best to contain it to where our community is not affected. On our personal protective equipment that we have, there is a national shortage. It's on the news. So kind of what we have is what we have. We are unable to get anything from our medical suppliers. We have received letters saying when they receive it, they will allocate it in the order that it was, in the order that the organizations have purchased. So at this time, we don't have anything on hand but what we have. So we are working. We have some wives of the fire department that they're going to pull the trigger and start sewing masks for us, just in case. So we're all working together. As far as fire department related, right now we are stretched thin trying to do this. We are trying to get overtime just to get people out there to screen and prevent anything from coming into our community. Do we have any questions?
The people that fever, what do you send them back home and they come back and check them out again?
We will give them a mask so they can cover up, and then we advise them to go home and contact their primary care physician. Right now, there's not enough tests available. We can't order a test. They have to see their doctor, call their doctor, and their doctor will advise them, yes, you meet the criteria, go to this location, but kind of like a prescription to get tested.
So if they got fever, we go to Lowe's, you still gotta go in?
No, no, sir. Lowe's is refusing entry. They have the right to refuse service, so that's what they're doing, which is a very good practice.
But they'll bring the groceries out to them, right?
Yes, but unfortunately, the individual that needed something needed eggs, and they didn't have eggs. So, but yes, we're working to figure all that out. We've been trying to be very proactive for the community members. It depends on which source you're looking at. I know they put out 15 days. Let's go for 15 days, but it could last a month, 5 weeks, 2 months. We're really not for sure. The information we're getting, everyone's kind of unsure at this point. Yes, and I know HEB put out yesterday evening, their warehouses are full. Just remain calm. There's no reason to panic. The supply is there. It's just keeping calm. That's what we're trying to do, being out there with the public and let them know, relax. We'll get through this together. There's not a shortage for the community. We're trying to make that happen.
It is confirmed there's no cases yet, right?
It is confirmed there is no cases. I know the news media reported on Saturday evening that there was a case. There is no cases in LaSalle County. If and when there is a confirmed case, I will get the first phone call, and the judge will get the first phone call, and we'll know before the media gets a hold of it. So, yes, there is one in Medina County.
One in Atascosa County.
I believe as of this morning, there's 2 in Atascosa County. So it is trickling out of the metropolitan areas, but per the governor, most of the cases are in your major metropolitan. But you got to think about the travel. We're along the I-35 corridor. People are traveling back and forth. They stop at Flying J, Road Ranger, it's gonna, there is a chance of transmission at that point.
From your point of view, Denny, I mean, this is something new for us, we've never seen it. What would you think, and also for the judge, recommendation about the courthouse judge? I mean, I know there's a lot of work, I mean, I'm not saying just to shut it down, but what about the public? I mean, cut it, I would say like cut it completely. Even though one or two coming in, or, I mean, it's still coming in and out.
I mean, we'll cover it in a minimum good declaration. I wanted you to hear a couple, things that we're doing. Additional, what we're doing additional, you can have a seat. Is that, I got Carlos Benavides here. Mr. Benavides has been doing oil field hazmat, cleaning, and he has the EPA license to do disinfecting on a commercial level with the hazmat suits. And I asked him to try to get as many masks and PPE as possible, and he's working directly with 3M and Bayer, I believe. And he's managed to also get 190 gallons of disinfectant that's used by hospitals for viruses, specifically the coronavirus that's being used. But what we're looking at is, and I'm open to the suggestions, is that last night the governor said that this is probably going to go on through April, mid-April, into April. So school's probably going to be out for the year, unless they have summer school. And I asked them to get enough chemical to spray all your public buildings, all your schools, all your businesses like your post office and along all I-35, because that's where you run the risk of the virus and people come in because they touch. And I got the gloves on too, because I grabbed everything. But it's that important. There's not a shortage of gloves, there's a shortage of masks. And the N95 masks are really, really hard to get, and we may have to get to where we contract to sew masks, because it is a deadly virus, especially if they're elderly, the people that have diseases, and we have to respect the space. Uvalde County is only allowing one person in the store at a time per family. And what that does work is we got caravans coming in from San Antonio or Laredo, then it's one person per family, then only they can go into the store. And we can set strict rules. We can have their working hours, county member there to call, identify them, but there's other things that we can do. We as public servants took an oath to go public service to defend the state and the United States. So we are public servants, and our employees are public servants. And I know they fear for the family, but there are times that they have the benefits of a secure life, and then there's the times when you have to be public service. So each one of the office in the courthouse has to serve that role. But it may be worth it to scale it down and have some skeleton crews. But if this thing goes on, then you have to provide essential services. And it's just not right to have just the ambulance people out, the jail people out, the law enforcement people out, and then we're all at home, not worried at all, and taking a check. It's not right. We gotta do our service.
No, I understand we gotta do our service. I mean, but right now at this time, it's not pinpointing that they gotta work, this gotta work. I mean, go there or help out, I mean, I'm just saying, not sending anybody home, but, just for the protection of people coming in and out.
We could shut certain offices. We set it to where they're taking the screening, a temperature screening, and they're not allowing anybody in. And I know last week there was a UPS person that didn't want to take a screening. When he'd come in, he had to leave the packages outside. We don't have any positive tests at this moment. There was something on Channel 12 that said we were. We checked it, and then Channel 12 backed it up. But we're along the I-35 corridor. And at some point, we probably will have some positive results. But if you control those high traffic areas, it's fine. So if we do it for one week and close down the courthouse, One is making sure the employees stay at home. That's important, because if we're gonna give them off, and they're gonna take off to San Antonio,
Yeah.
or they're gonna go to Laredo, you know, we find out they're fired. We need to understand that each official says that they're gonna go home, because they're so, and they, you know, and we find out that they're on Facebook or Snap or somewhere else, they're fired at will. Then that's what they are, because then they risk of bringing whatever in.
No, and I'm not saying, you know, to shut it down, I'm just saying for the public to try to protect the one we have here.
Yes.
You know, I'm not saying to shut it down, I mean, it's the best for everybody, you know, I mean, I know there's a lot of work to be done, there's a lot of work to be done in the courthouse, I'm not saying, I'm just trying to protect who's here and in and out, a lot of people coming in and out, and,
Because they're controlling it two per office, right now. And if we shut it down, do we shut it down to the public, but they stay working? Or do we shut it down completely to where we close the door? And then are you gonna pay those employees? Because I mean, Jim Ellison said that they can take sick leave or vacation unless they're in a protected class. My order's good for 7 days, but at the end of the day, we have to do and treat everybody the same. We're gonna pay them all, or we're not gonna pay them all. Unfortunately, your law enforcement, your fire department, it's in their duty, your jailers, go get it, dispatchers, they can't go home. They can't go home, and it's not fair to them either. But if you're gonna close the courthouse and let them do work in the office, that's fine. But if this thing extends to April, we still need to provide those essential services. You still got people that have to file deeds, and you still got people that, you know, registration, they wanna pay their taxes. You can pay his taxes as much as you can online, and up to you, we close it for the week to the public. We can do skeleton crews. Some counties, we have a number of counties that have closed altogether. I talked to Herb Briscoe yesterday, and he represents a lot of counties that just closed it down. Some have been skeleton crews. And meaning you're rotating people out of the office. But whatever we do, we need to make sure that we do something fair for all the law enforcement and all the public servants that are out there, because, you know, they're more at risk. And it's a hard decision to do. Dr. Roth is our doctor. South Texas Rural Health reached out, that they have a lot of resources, and they really haven't had any cases like Zavala, Dimmitt, and a lot of West Texas counties. Eagle Pass has had one, about Verde has it. But Mr. Zamora is willing to work with us to help us. You know, they can help us with the screening, and it frees up your firemen. You know, we need to reach out and bring those medical doctors in. So I was gonna ask,
Is there a quick training or that you could do like to us out here, how to do that so we can be out there helping you out?
We can. I was looking at if it's a medical professional doing it, then any questions that those people would have, we're already there. We can answer those questions.
so if we reach out like South Texas Rural Health, will you help us to streamline the big, bring the people that take temperatures and stuff and help us allow this? We're being very aggressive, and part of the reason for the decontamination we're looking at is that you have a lot of traffic coming in. And if we can delay any infection, it's better. But we don't have doctors that live here. We do not have a hospital. We have limited clinics. So on many of the response from medical, it's been the fireman or the paramedic. So, and that's why we gotta be extra hard. And as the governor said yesterday, he's leaving it up to each county to decide. And he has 254 counties, and only a portion of those have tested. He doesn't feel that he should use his influence on all the other counties, especially when you haven't had any positive. But all along the corridor, and look at 37, Atascosa, look at Medina, look at Webb, all along the corridors, eventually with people coming through, it's gonna happen. And by decontaminating it, then we limit the chance that we infect more of our citizens.
The cases are gonna go up, and they're gonna go up really quick because test kits are coming more available. Testing's getting, quicker. You're gonna see these numbers rise exponentially, I would say, over the next 7 to 10 days. Just so, we're all aware, you're gonna see a big influx really quick.
And seriously, we need to hear from the officials, whether they want to close their offices, if they're afraid, do you want to close it to the public for a week and just work in your office? Because let's say Margie has 4 desks, she's crowded. I don't know, they're 6 foot apart. If we do a skeleton crew, huh? If we do a skeleton crew, maybe they could split them out. So that's one thing we need to look at, especially with.
And I understand there's, like on the pay, I guess Raul and I don't know, or, they got some people that's over, 65 or older, and why are they gonna get paid and we have to work? Right now is not the time to be pointing at anything, if they're at age or they're sick, it is what it is, and if, whoever has to work, we're trying to do the best for everybody, it's not,
I get, and they were, fire department was really good at pulling a lot of different orders from different counties, and they did. And your groups that are most vulnerable are over 65, people, cancer remission, RA, your mothers that have children less than 1 year, some of them are nursing, pregnant mothers, and for their immediate protection, send them home, knowing that we're going to have this meeting today, and then we decide whether it's fair or not. Because on some of these people, like we shut home, we can have them do work. But in your case, like you have some men that are over 65. Well, I hadn't thought about it, but if you ride in one vehicle, you're less than 6 feet apart, so it can only be one per vehicle. So they can still work, but they got to be away from everybody. So the 7 days that I did the declaration that ends this week, then your order would stand. But this is let's get together, let's get our minds together, let's come up with some ideas. We can't send the sheriff home. He's like 90 years old. But he's 65. He's 65. We can't send him home.
Told me he was 59.
No.
What? 59.
And don't back out on it. It's on your voter registration. But we have some elected officials that are over, and sometimes they criticize you're not doing enough, but then they don't want to go home either. Well, what's fair? So for those people that fit a class, if there's a possible way to do work from home, great, at least for a week. We can play it for a week. There's things they can do, that we can assign for them to do.
My main concern is just, really thinking hard about it before it spreads out and say, we should have stopped it, and, we just let it go,
Well, it's okay. If we close it to the public and take it online, or they can fax their stuff, or Margie does get cases that are e-filed, but even the Office of Court Administration has stopped certain procedures. You can't do evictions. Emergency order you can do, and I think Mr. Verdial has been putting all those different orders online, or is going to start, as I get from the Office of Court Administration. Texas Jail Commission has some strict standards that they're not allowing visitation. They close down the jails. And what is happening is that at the jail they lack PPE, which is the glove, the mask, and when they go get a prisoner, they're going to check the temperature. His temperature, they're going to leave the prisoner out and bring him into the jail. We asked the warden to try to get more nurses through contract nurses to be able to have someone to screen them to go in, because the fire department has been handling it. But your prisoners at the detention center in Ensenada come from all over the world, and it's really important that we put those resources there. and they can't go home. Mr. Zamora,
Yes, sir.
I briefly mentioned that you have resources available to get the medical clinics together, to get staff together, because I know the fire department's been running pretty hard at screening individuals, you know, and I know you have, not only that, you're able to medically assist in treating the virus, and we're on live right now, and I don't know, you know, if you can kind of explain to the commissioners what you expressed to me Friday, that way we can add you to the resolution as well.
Yeah, if I may, Judge. I sent something to your assistant, to Ms. Cruz,
Yes.
for you to contemplate as we continue. But let me tell you, South Texas Rural Health is really the health agency for the area. You see, it used to be that the state used to have health clinics all over the state, but most of our funding, actually our funding is out of the federal government and the state. So all the services that are provided by the federal government and the state are encompassed in South Texas Rural Health Services. So we are the health agency for the area. But we're in tune with the Center for Disease Control, which is really the commission that is on top of all of this. One of the things that is true about the media is that it's we're having a difficulty in getting the supplies that we need. We do have the masks. We're trying to identify and where to send the individuals if they need further assessment. But the thing is that we're set up to do all of that. We do preliminary. If somebody has a concern, the best thing is for them to come to our clinic. At that point, we will deal with their mental state, because we do have all the resources encompassed. We have medical, dental, substance abuse, mental health, wellness. So all of those services are taken into consideration in assessing the individuals that come in. So the best thing that we can promote is if they have any kind of concerns, even if they're not sick, go to the clinic. We will put them at peace and develop a health plan for them. We know where to refer them if they need more assessment. And we do have a program, if the individual has fevers and meets some of those symptoms that are being identified, we have to quarantine them for some time to see how that develops. If it gets serious, then they need further assessment. We will send them to a center where they do it. We're waiting for some kits to assess the virus, but needless to say, there's a shortage, and we're not really top priority simply because rural areas have never been top priority. They're going first to the urban city where they have already identified some cases and where they have to put more efforts. But slowly but surely, we're getting all the supplies that we need. But most of all is that we have the process to deal with any individual that has concerns. So instead of having them out there wondering if they have it or not, the best thing is this: you have some concerns, go to South Texas Rural Health Service. And we have a clinic here. We have one in Encina for LaSalle County.
I know Chief Mendez had mentioned we started screening at the Lowe's. And it's also helped to allow them to stock up and be able to provide more for the public. But they had a number of people that had high temperatures, and whether they sought additional help or.
But you see, and those are elementary assessments that are done to protect their population and to allow people to go in or not to go in. At that time, probably the best thing for them is to say, you're running a fever, I think that you ought to go get more assessment at South Texas Rural Health Services.
And we can definitely do that.
Yeah.
do you have staff that can help with us at, like, Lowe's to help do assessment? You
For
know?
what? For the county or?
Yeah, for the county.
Of course.
And I know there's a cost that comes related to us, but it frees up time. So I know there's costs related to that, but it frees up time. So if you have someone that can take temperature and help with the screening, then it frees up one fireman here, one fireman there, and, you know, we pay them and we keep track of the costs. The federal government's requiring that, you know, we keep track, so it's not like there's not a chance of reimbursement. You know, so I think we can probably work that out.
I actually have a designated person tracking all the costs already.
And in the jail, they're taking readings of the prisoners before they come in, the local prisoners. So if someone's under arrest, instead of letting them go, I think they should take them directly to South Texas Rural Health.
And I
for
think that we
screening.
already have that relationship, Judge. If anything happens at the jail, they will take them automatically to South Texas Rural Health. And again, there's, if you want us to set up shop someplace else, yes, we can do that. And, but if we, to expedite, if it's one person or two person, they can go directly to the clinic. All we gotta do is get a call from you and we'll process it.
Mr. Zamora, are the hours gonna change?
No,
So it's 8 to 5, Monday through Friday?
right.
Okay, so the only
And
problem,
after hours, it'd be Frio County.
yeah, it's gonna come back. So even with somebody gets arrested before they go into the jail here, after 5 o'clock, we would still,
Well, let's see, now that you bring it up, we can, I can go back and we can discuss how we can cover that time also. Is it because I think that we can do some on call, you know, where we can respond to your need?
I mean, we still have a problem doing that. That one's, it's, right now where I'm coming into an issue is I have to get staffing to be at Lowe's
Yeah,
and
and,
so forth.
You're right, the time that we, right now as it stands, it is a fact that you would automatically take him to the hospital as an emergency.
That's correct.
Yes. So let's keep that. Let me go back and let me talk to my staff and see if we can set up an on-call kind of situation.
Okay. And the other, I think it's important, we need to get with the ER director for regional, because not all the people are going to Fruita Regional, because they're under strict standards. They don't have the PPE anymore. They're running low, so forth. And there's a process you have to go through, even us in the field, that we have to call and notify. They meet these, the symptoms. What do you know, what's our next course of action? So they have a heads up before we just show up to the door.
And I think that, again, what we're gonna do is that if they have symptoms and we treat them, we give them shots and we give them medication and antibiotics, but we have to send them home and let them, let's say, I think it's 14 hours or a period of time to see how it develops. If it gets more serious, that's when we're probably gonna have to send them to a center, and probably it'd be Frio Hospital for our area. We wanna make sure that Frio Hospital has the test kits. So we have those contacts, and if not, we have relationships with Methodists also, that we can maybe send them to San Antonio. But it is not we should not panic that the individual has those symptoms, because there's a process that we have to follow to make sure that we don't send everybody that feels that they have it to a testing center.
And that's why when they get screened and meet a condition, you ask them to follow up with their doctor or South
Right.
Texas.
Yeah.
You make them, not make them, but you suggest that they follow up. And I know people will say, oh, I just have the flu, or I might just have allergy. Get it checked out. It's very important to get it checked out now, at this point.
Yeah, let me tell you an incident, and I know that people panic and they become seriously concerned. We had an individual that came and we tested them, we gave him, did all we have to do, and we sent him home. Well, he wasn't satisfied. So the individual went to Frio Hospital. Well, they tested negative here, and they went over there to get a second opinion. It was negative also. But see, what happens there is that individual created a financial burden on themselves. This is because the hospital ain't gonna do it free. So we are in a position to give discounts, but because the individual wanted a second opinion, and which is okay, but he created a different kind of bill. And if he didn't have insurance, well, it's they're still gonna charge him, the regular price. Okay? So somewhere on the line, we have to implement something that it will be common practice, and all of us have to sort of preach the same thing. Go to South Texas Rural Health. Let's start with that, and we guarantee that we're going to do the best and create a health plan for that individual that will bring some tranquility to that individual's state of mind.
Judge, I think we have to go down to the harsh reality. First, if they do meet the screening, it could be 2 to 14 days of what's been put out before they exhibit signs and symptoms. Not everybody's going to have symptoms. The reality is there's people that are carrying it, transmitting it, and they'll never have a symptom. So that's one aspect I believe everyone needs to look at is we got to limit the contact at that point. And the other harsh reality is we're a rural community. I hate to say it, we're kind of on our own. We got to take care of ourselves because the focus is not going to be, unless you're a big city, Laredo, San Antonio, Dallas, Austin. So everyone working together to develop that plan, it really needs to.
And I think in the development of the plan and in the resolution, we include South Texas Rural Health, as the go-to. And then we can work out to where, I know you have 24-hour, but I'm sure he can assign someone to answer the phone. If you get a midnight call where they actually meet the conditions.
Yeah.
And then from there on, that way you don't have to run straight to Frio County every time.
Sure.
And then, so after hours, you can assign someone to it, or for the jail as well. Now, the jail in Ensenada, you have a different doctor that's assigned to oversee that jail. Yeah. Because that's under U.S. Marshal, so you have a different doctor that handles that. That's the only exception, but the rest of the county would be for you. They're saying the social distancing, the hygiene, washing hands continues to be very, very important. I'm recommending that at your stores. They started doing that in San Antonio. They started doing it in Uvalde, that they put a marker of 6 foot. And we can put it as part of order that if you can't register, you gotta be at least 6 feet. And then we may want to limit it 10 people per store on the establishments as well, because you go to the grocery store and everybody, hi, they're all real close. They're all real close, and that's what we're trying to get away with. Those are your high-risk areas. So even though they're exempt, we got to make sure that they follow the 10-person rule.
Just to put things in perspective, and that's, we have the jail and you have a doctor there, but the community
Yes.
ought to be advised to go and visit us.
And as I said, everything outside the jail, including Ensenada, Fowlerton, Millet, Gardendale, the whole county.
Right.
It'd be the whole county. We got a little pushback at the last, when I did the resolution on the curfew. And we have the ability to do a curfew. And the school's gonna be out, the children really should not be outside. or away from your family. Make it easier, we can do a 24-hour on the children, 18 or less, unless they're with their parent. That's a recommendation because it's serious. They want people to stay at home. They want the nation at least until April 3rd goes through. Huh? The swimming pool's closed. The swimming pool is closed. All parks are closed. All playgrounds are closed. The Babe Ruth, the National Babe Ruth has canceled all league play. Little League has canceled all league play. EPS has been closing its offices.
Even the churches are closed too.
Only for the CDL. All the churches are closed. So there's quite a bit of closure. If you want to close it for this week and then next week we start operations 2 and 2 and 2, we can. But it's your decision. If you want to close it just for this week, but we still need to find a way to compensate the emergency personnel, law enforcement, for that. Or, so we have a ways to go. Mr. Benavides, I don't know if you would like to explain to the Commissioners Court the type of disinfecting you will be doing.
Yeah, so I'm Carlos Benavides with GCA Safety Solutions here in Catulo. We've gotten a hold of a manufacturer that's able to release 200 gallons every 200 gallons every 7 to 10 days. It's 100% hospital commercial grade disinfectant. It is 95 to 99% active in preventing COVID-19. So it's the same product that they're using in New York right now, Arkansas, California, and now Texas. The only thing we can do here locally is preventive measures. So what we want to do is start decon, disinfection of offices and places where we would call hot zones, like Flying J, Pilot, the Loves and Incident, all that good stuff, where we have a high number of traffic, high number of people coming in. Chemical does arrive today. I've been in communication with the judge. I think we're going to start doing the decon process ASAP. Do you all have any questions for me?
One of the things that we looked at is like Victoria does the applicator's license. Now this is, if we do have a case and it gets worse to one of your resources, those people, applicator's license can also do the contamination. I reached out to Silver Vasquez at Texoga. You have a big presence of oil field, and all these oil fields have been trained in hazmat. And the virus can be treated just like you do H2S gas, to where you have the preventive measure, they have the PPE to be able to come in and spray. So he was going to reach out to the city of San Antonio to see if they can get teams of oil field workers to go in and help with the decontamination.
Let's talk about those. You say how many gallons? 200 gallons?
We have 200 gallons. We have access to 200 gallons every 7 to 10 days.
How does that come? If I get in buckets or?
No, it's going to come in a drum, in a 50.
And how do you put it out?
We have a special fogger unit that we put in play over the weekend. It's going to be in a decon trailer.
The sprayers that we have for mosquitoes, that won't work to spray out?
It can, but we need to make sure that that sprayer is 100% clean. It can't have previous chemical or any type of contamination that would hurt this solution that we're going to put in there. So basically, for us to use that sprayer, it would have to be brand new. Not ever had any type of pesticides or anything in it. It would be nice to put that in our foggers. Maybe we have a fogger that hasn't been contaminated with any harsh pesticides.
The only one we use is just for the mosquitoes. That's all spray.
I would have to see the SDS sheets on it, and I think the fire department would have some more information on it.
But they couldn't be that expensive to do.
I was looking at a truck-mounted fogger, truck-mounted fogger unit. They run anywhere between $2,500 and $4,500. That would allow us to go through the streets fogging.
That's what we pay for the machines. You won't get them from one day to the other.
There is a 60-day wait.
And that's why it's important, like we talked to the Ag Extension agent, because because it's being so closely monitored, you gotta make sure they have their applicator's license. They gotta have an applicator's license. So if she can have a class for us, or then we gotta have it. He has an EPA license and certification for equipment. I know some of the other counties are reaching out to him as well. In the Middle Rio, they're making disinfectant, and I was asking whether there's a shortage, so Daddy's looking into disinfectant because they're giving it out to the citizens for free of charge. But it costs the counties about $8,000 a day for 25,000 gallons. So that's an option that we have. We can always come back and meet and cover that. But for the time being, of all your high volume areas, disinfecting of these people, make a difference. The school, for example, you can disinfect the school one time right now, since you're not in school, you don't have to do it every day. But your stores have to. Lowe's has been very, very involved. They came to the meeting. We've had a little pushback from Family Dollar and some of those stores. So in those cases, we got to make sure that it's a 10 people rule, and they have the markers. We set the resolution, and even though the governor said these businesses have to be shut down, keep these open, then Commissioner's Court, the city of Petula, they have the ability for those businesses within the area that we have wide to say, hey, in addition to whatever the president's doing or the governor's doing, we're going to put these additional conditions. And he made it very clear, the governor made it very clear in his address yesterday at 3 o'clock. And why are we overprotected? We're overprotected because of the lack of medical resources. And if you get a family member sick and having to run to San Antonio and come back, is really, really hard. And finding bed space might be hard. They're thinking that it's gonna get widespread. They're saying there's not gonna be enough beds. The governor said he's called the National Guard to set up hospitals. So can you imagine having a loved one not being able to go see him at an Army Field Hospital? So I think we should do every single thing that we can to make sure that we delay the virus as much as we can. I don't think we can stop it, but I think we can delay it.
And also, real quick on our supplies, we are about the only ones that have a N95s, mask, and personal protective equipment. Since Monday of last week, we decided to hold all those supplies in-house for LaSalle County only. I have stopped the sale to oil field, and it will be distributed among the fire department. We're in communication with the fire department, county officials. Our supplies that we have and that we are limited to will be going to the local officials and local departments here in LaSalle County.
Danny has secured about 400 masks.
400 to 500 I have right now. We've given out to the sheriff's office, the jails, and us enough to get by for a little bit. I have 400-ish right now, but what I'm afraid of is if we hand them out, people are just going to use them, and there's not a supply chain really coming through. So what we're doing is, as needed, if the sheriff needs more, he just comes, here's your next allotment, and so forth. And I'm keeping that at the Emergency Operations Center so we can kind of keep in control without.
And how long do you use it? 1 day?
Well, the N95 mask is supposed to be replaced after each use. Right now, I don't have an answer for you.
We are being advised that we can use them for a week.
What they've been doing, and I think they've been looking at, some of the hospitals, what they're doing is they're getting people to sew masks to put them over the N95 mask. And the reason that your first line protectors should have responders to masks is because the jail, you got close quarters. You have more interaction with people. The EMS people get called for, to visit sick people. The hospitals and the clinics do too. So it's really important that they're the first ones to get the masks. And I don't know if you have an adequate supply as well, but if we need to chase masks down for our clinics, then we need to know.
They're going to be needed because you cannot they're disposable. So in our environment, probably the most we can wear is for about a week.
So you only have about a week's supply.
We got minimal supplies and it's gonna be gone pretty soon.
And we ourselves have about a week's supply, but we placed an order about a week ago with 3M. They're telling me 7 to 15 days before we get about 1,000 more masks. So if I place another order today, it should get us another 1,000 more for the next 20 to 30 days. And they are capping it at 1,000 per week. So I can't go and say, hey, give me 5,000.
On the national level, I know they're starting to procure and take stuff. Are they 3M gonna cut you off?
Well, as of Friday, I was on the phone with them. They're not cutting me off. I was able to buy and purchase enough supply through the year where they're keeping me as a top vendor for the area. So they're giving me 1,000 every week. Yeah.
So what's the cost?
The cost per mask right now, the price has not changed. You're looking at about what's the cost on it? About $15 a box of 20, roughly.
And you have some stock at this time?
I have stock, but the stock we have is reserved for the county right now.
And that's why if we decide to cut operations, save on the mask, let's say we close the courthouse down, then, you know, we don't need masks.
Now, as of this morning, 8 a.m., glove manufacturers have told me that they will be cutting down. Production has slowed down. They themselves are sending people home. They're not producing, on the glove sides, they're not producing like they used to. So if you could stock up on gloves, do it now. We placed an order this morning. The gloves are right behind the N95 mask. We're gonna have the same issue in about 7 to 10 days. And this is coming from 3M and all your major manufacturers. On our end, also, if you have any cases on the fire department where you have an individual that has the COVID-19 symptoms and the fire department would like to call us, we will decon your unit and get it prepped for the next person coming in. I will be answering phone calls 24 hours. I do have a team on standby. Same thing with the sheriff's department. If we get somebody with symptoms in the patrol units or whatnot, give us a call. We have a special chemical set aside for both the fire department and the sheriff's department. And DPS.
I know, Mr. Real, they have questions online. I know they're coming in. I don't know how you want to answer them or address them. So they can request them in writing on their questions, or do we respond now? I mean, I don't know how there's a way to answer the questions. This is our first time we live stream it, and under the Open Meetings Act, we can ask for a waiver and do everything, but this is just like a regular meeting. So for those people that have questions, are we asking them to put it in writing? We'll answer to them.
There are going to be several repeat questions. We might put out frequently asked questions, but I need to go through the public information officer to get the answers
Okay.
first.
So we're asking for those people that are watching the video to make sure that they type up your question, send it in, and we'll respond to you. At this point, I'm gonna read the resolution. This is executive order, declaration of local disaster for public health emergency. I had it changed I changed it for the Commissioner's Court. Plus, we'll add for South Texas Rural Health. The resolution being, whereas beginning December 2019, a novel coronavirus, now designated as SARS-CoV-2, which causes disease COVID-19, has spread throughout the world and has now been declared a global pandemic by the World Health Organization. And whereas symptoms of the COVID include fever, coughing, shortness of breath, and death in some cases, and whereas COVID virus mainly spreads between those individuals who are in close contact with another through respiratory droplets produced when an infected person coughs or sneezes. Whereas extraordinary measures must be taken to contain COVID-19 and prevent the spread throughout LaSalle County, Texas. That include banning individuals, group of individuals, or property to undergo additional measures that prevent the control of the disease. Whereas the state of disaster requires certain emergency protective measures be taken pursuant to Texas Disaster Act of 1975 relating to emergency management and public health pursuant to Texas Government Code Chapter 418. Now therefore it be proclaimed by the county judge and the Commissioners Court of LaSalle County that a state of disaster for public health is hereby declared for LaSalle County pursuant to Section 418-108A of the Texas Government Code, that pursuant to Section 418-108 of the Texas Government Code, the state of disaster for public health emergency shall continue until April 3rd, 2020, extending the county judge's declaration unless continued or renewed by the Commissioners Court of LaSalle County. That means mine expires and yours starts until April 3rd. Because mine is only good for 7 days and then yours as follows. That pursuant to Section 418 of the Local Government Code, this declaration of the local state of disaster for public health emergency shall be given prompt and general publicity and shall be filed in the county and district clerk. That pursuant to Section 418D of the Texas Government Code, the Declaration of Local Disaster activates the LaSalle County Emergency Plan. Whereas, in addition to Governor Greg Abbott's declaration of closure of all bars, restaurants, or going to gyms, takeout, delivery, drive-through are still allowed. Visitation to all nursing homes and long-term care facilities, and closure of all schools until April 3rd. At midnight, the gathering of where 10 or more people are expected to attend to congregate are hereby prohibited but not limited to privately operated game rooms, county parks, county-owned practice fields, and the county pool. So they're closed. Whereas, in working with local governments and in order to provide the need to have sufficient staples for residents, the local grocery store will provide dedicated time from 7 to 8 to senior citizens to purchase at Lowe's. Whereas the county EMT staff will provide temperature testing and screening to all patrons at Lowe's grocery store. And we can do, we can add to it, but can be expanded to other high volume areas, pending staffing. Grocery, any patron with signs of illness would not be allowed in the store. However, employees will work with the patron to provide the needed staples and requested items to tend to the need. Furthermore, patrons or consumers will be directed to South Texas Rural Health Services. Whereas LaSalle County will be providing commercial sterilization of places using EPA-approved contractor to provide decontamination of high areas in the county, including courthouse, jails, public buildings, kitchens, and commercial establishments, providing food and food products exempt by this declaration or any other declaration by federal, state, or local authorities. Whereas LaSalle County will require establishments providing essential services to have markers at cash registers clearly marking 6 feet from the first customer at the cash register and backward to follow social distancing recommendations. Whereas a 24-hour curfew will be placed for all children under 18 unless with a parent, guardian, grandparent, or close adult relative Monday through Sunday. Whereas all county personnel over 65, and we'll look at that, we can change that, Commissioner Alba, will be sent home for 7 days to include any county employee cancer, immune deficiency, or in remission, and any employee that is pregnant or mother with a newborn less than 1 year of age. Whereas all county offices, with the exception of Justice of the Peace number 2 in Ensenada, will remain open. However, each office will be only allowed 2 persons to be served at the time for each office. The county will take temperature readings for all people entering the courthouse. County time clocks will not be used. Whereas the county jail will be screening defendants to help prevent infection of the local jails. Any defendant meeting symptoms set forth by the CDC will be referred to South Texas Rural Health for further screening. Whereas the County of LaSalle has closed its indoor dining for services, which is the elderly nutrition program, to its elderly population over 60 years, and will be providing home delivered meals to elderly patrons of County of LaSalle. Elderly Nutrition Center. Any elderly without the care of a home provider may contact the Elderly Nutrition Center for home delivered meals during period of pandemic. And what I wanted to state is that with a shortage of eggs and breakfast materials, we can probably take the census of these elderly, and I don't know if Rose is here, but we can probably deliver breakfast to them as well. But in doing breakfast, the center prepares lunch. What we can do is we can contract with the local restaurants that have their food handler permits to be able to prepare those foods, and then we deliver them. Like I spoke to Uncle Mo's, and they said, depending on how many you have, we may not be able to cook them all, but whatever we can is limited, and she needs to know with advance time to be able to get supplies. And the only reason I say that is some of these commercial businesses have been hurt. But we also work at keeping these elderlies from going to the grocery store. So in planning this, if this thing prolongs, then if they know they're gonna get breakfast and lunch, then we're keeping those people from circulation. So that's something, if you wanna consider, see we can try to do, we'll take your recommendations. We'll take your recommendations. And we're looking at those businesses that are established, that have been providing breakfast. We're not looking at the businesses that do not provide breakfast outside their means, because they're already set up. We're not looking at the creation of a new business. We're looking at the established businesses that are doing already breakfast. Tahoe, Country Store, you know.
On that 24-hour curfew for the kids, it doesn't mean they can't go outside and play, right? Like some that have.
We're looking at, and we can define it as public places, okay? They let them go to the parks and go play in the playground. Or we're letting them, you know, run around town and throw a neighborhood in a bike. You know, you're gonna stay in your yard, you gotta stay there in your yard at this time. Bear County has said, stay inside home. And Webb County is saying, you stay inside, you know, it's kind of a lockdown. No, it's not a home shelter. We're saying a curfew to be on your property. You know, they gotta have air right now, but we don't want them running around, you know, in the neighborhood.
Another question, you have single parents, and they depend on their kids to be at school for them to be able to work. How's that gonna work?
Well, that's why I mentioned, my order was only for 7 days, and you have a lot of people are second. And what Jim Allison said of the Commissioners Association was, they got sick leave, vacation leave, overtime, and that includes the 65-year-olds. So we're gonna say the 65-year-olds that work. If you got some that are working for you, then they gotta be spaced. Your workers have to be spaced, so they can't ride and double up on a vehicle. You know, but for the immediate, until we decide what we're gonna do across the board, I mean, we can shut down operations for the county for a week, but eventually we'll have to deal with it. You know, we can't close it forever. So in going home, if you want to, you know, we decide to pay him or not pay him, or, you know, we're gonna give everybody, you know what, a week of extra personal time, and that'd be the easiest, okay? We're gonna give you all a week of extra personal time in this, and during this period of time, you know, then, for those that work, know that in July, August, whatever it slows, they can take an extra week. And that would be fair for everybody else working. You know, we got some people that went home and you gotta treat everybody equally. You know, you do 2 weeks of time and then look at it. Or do we decide that those people with illnesses, that we're gonna give the option to work from home? I mean, I got work that I can assign to a number of people that are coming in, that they can help us out. Right now, there's money in TDHCA. I need research done. There's a new COPS program opening. I can research that. It's about a week's work for each one of them. We still got a lot of printing out to do on some of these cases. You know what? To set up a printer at home, I got another person taking care of. So if that mother of those children wants to work, you know, then we can set up a computer. And you know what? A printer, and she can do that job for that week. There's other options. But it has to be justified. So if that one person that doesn't have a babysitter, because the kids are in school, you know, we need to know, but we can only do so many. Like Margie doesn't have a lot of work she can send home. You have some work that can be done. Probably EMS billing, probably some of the catching up on the human resources, maybe. Or if somebody else reconciles any of your accounts, maybe that person. But that's going to be limited. Yeah, so other than what we assign them. I don't know if Victor can transfer calls to a personal phone. We can have him answer calls at home. You know, in the case of the JPs, he said, you know what? You're at home and you can take the calls. But we do have a lot of young people at work that have families. I mean, we need to take a census of that. But it's very hard. It's a hard decision.
It's hard, it's gonna get harder, it might get worse.
But I'm telling you, we're gonna be hit hard this next budget cycle. There's gonna be reductions. We're gonna have to make cuts as a county. We're gonna take a hit. So, you know, and we need to plan. So, I mean, what do you want to do? I know you mentioned about closing down. Do you want to close down the courthouse for a week and then give everybody a chance to organize?
I think it's a bit too early to close it on this way, that always what happens.
I wanted to wait for about a week and see what happens.
Yeah, no, it's not that I wanted to close it, it was at least for the public, you know, to try to, keep them a little bit.
Mr. Leon, last week when you started doing your testing, how many people are coming to the courthouse?
I haven't tallied the sheets that we have now, but it's quite a few. It's tapered off a little bit. Right now, we're not having a lot of public coming in, like before this epidemic came across, but it wasn't a huge amount. We always have people coming here. The other things that, while you have me up here, Your Honor, tomorrow we have district court. The docket, and as I've already checked this morning, it hasn't been canceled, not a big deal. I don't even think the district attorney is coming tomorrow. It's only 3 criminal cases. But on the 30th, and Margie can maybe correct me if I'm wrong, we're set up to have, I don't know if the summonses have gone out, a jury selection. This place will be packed.
What happens is we as the Commissioners Court have the ability to close the courthouse. And that's the thing is, So we close all court proceedings, and the Office of Court, Administration is recommending that you close them anyway. Any of these proceedings, trials, so forth. So in honor of them, I'd say, hey, we can add to the resolution, so you know what? All court cases, unless it meets those recommendations, the Office of Court Administration for emergency order, let's say they have to remove a child or do something that the courthouse was gonna be, close to those other than your registration, your deeds. Even for Mary, I would suggest that we close, but she can also close her office to the public. And they can do POs. He said, they call for a PO, take a picture in an Apple phone, send it to them. But each office has the right to close their office. We can limit the courthouse, and when people come in, Margie can set her own hours. But we want to make sure everybody's working together, but they can't get paid if they're not working. That's where we come in. So I'm open for recommendations on what you want to do with the staffing. Look, we got everybody budgeted, okay? We got everybody budgeted. So even if they get home, they're still budgeted. So my recommendation that if they want to go home and we close an office, then we let that elected official. However, that we're only going to do 10 days, no more than 10 days. If they choose to go home, 10 days. If they choose to go home in August or wherever, or July, whenever they decide to take the leave, then they don't get it. They're going to use the 10 days we're going to give them. That gives your firemen, your law enforcement, your jailers, your dispatchers a chance to get 10 additional, days to take off at a later time. And I think that's probably the fairest thing we can do.
I only got 2 workers, and my full-timer is still getting paid, it's gonna be only 10 days, right?
Yeah, it's only 10 days. And that takes care of your full-timers as well that went home, somebody went home.
Amen.
Now, the rest of the world, not everybody's paying some. Some people are paying people, some people are laying off. We have a number of people who have been laid off not getting checked. And I don't think we should be treating our people any differently. So if we get to the point that this thing lasts and they don't want to come back to work or we want to close it down, we may have to lay off. We may have to lay off. So for those mothers that can't do it anymore, after the 10 days, if they can't do it, then they take sick leave, vacation. If they don't have to leave, then they get laid off. That's what they do across the world. That decision has to be made to treat everybody fair.
My
Yeah,
concern is,
if you can get work assigned to them to do for special tasks, I mean, that's done, but it's limited to a very few.
like my crew, I can keep my guys, I got 3 guys and, a lady at the park, she's over 65, but, my concern is still, it's not time to be playing or anything, just the more we can keep people spread out, especially the courthouse, more people coming in, it's not that I'm playing against it, the thing is, we need to work together to keep them, spread out, they can work, skeleton crew, it don't matter.
We're limiting.
The lesser people together, the better.
We're limiting the people that come in. We can change it to include that we're canceling, all trials and juries. That's child support, district court. We can do that. We can do that. We're going to cancel that. So that way, you're not going to have the large jury trials. And I don't think they're gonna buck us on that because you have that authority. We have that authority. So if you want, we can go ahead and do that. I think Mark would probably feel better, right? No more Attorney General, no more.
Your Honor, the Attorney General notified me that they are not holding more until further advice.
So like on that, Judge, we'll leave it to every department head and they're gonna do a skeleton crew or?
Yeah, we'll do department head, you get these days, and that's it.
Like a
And
man,
make it very clear that from this point, after that point, unless you have special work that you need to do at home, you know,
like I said, my crew, I don't have a problem at all, you know, they're spread out, like, they can be spread out, only three, you know, I'm just saying, you know, I guess this is one of the main buildings, you know. You know, they all are shut down, you know, that's my only concern, you know. I mean, and they can work, there's a lot of work to be done, they can catch up work or whatever they gotta do, you know.
any other feedback?
Judge,
Yes.
could you clarify a day, because the fire department works 24 hours, the jail works 12-hour shifts, and some of the deputies have a 10-hour shift, so could you clarify hours or specify
What I'm
their
looking,
current days?
what I'm looking at is two 40-hour weeks. If it's a law enforcement, then we'll do, 43 and a half hours? And what's a week for firefighter?
56 average.
Then it'd be 256, respectively of each federal requirement, if that's okay. Because that's what the federal government considers their work week. And then if you want, commissioners, then we can add to the order, say, hey, okay, you elected officials, you can decide on your own, you got these days, you know, but we'll still limit the amount of people that come into the courthouse, and we close all courthouse proceedings. I know that the Office of Court Administration, you said Attorney General said they're not gonna have any more hearings, but the Commissioners Court still has the right to do that. As in school, Chapter 418 gives the right of the Commissioners to close all schools in the county, but they ask us to work with the district. I've been working with Dr. Seals, I've been speaking to Dennis, and they're closing their own decision, so they're working on their own. So I don't see a need to put it in the order since they're doing it. If we feel that there's an outbreak and they're not, then we'll come back and discuss it. But at this point, we don't need to. And we'll put in the order for the elderly, and we'll take a census from Rosa, because she's irresponsible, and we'll let her work with contracting those businesses that are already providing breakfasts.
This is including tonight too?
Including Ensenada. But I don't think Ensenada has any restaurants. It may have one restaurant that has health permits. And as of today, there was one restaurant that did not want to comply with the no dining in. So, Chief Mendes is taking care of that. So, in accordance with the Texas Government Code, Section 418.173, a person who knowingly intentionally violates the order commits an offense punishable by fine up to $1,000 or confinement in jail for a term not to exceed 180 days. The purpose of this order is for emergency management measures, mitigation procedures, and response plans to a public health emergency. Captain Sean Wallace, EMT, fireman, is the designated public information officer for LaSalle County. His number is 830-202-4322. In testimony whereof the Commissioners Court of LaSalle County sign our names and affix the seal of the Commissioners Court to be fixed at the LaSalle County Courthouse this 23rd day of March 2020, effective upon signature and lasting until midnight, April 3rd, 2020. It'd be Noel Nieves, Commissioner Precinct 1, Joaquin Alba, Commissioner Precinct 2, Erasmo Ramirez, Commissioner Precinct 3, Raul Ayala, Commissioner Precinct 4, County Judge Jorge Rodriguez Jr., and attest Margarita Esqueda, LaSalle County District Clerk. And I'll make the changes, get them to you, get you to sign them, but we would need a motion to approve it, and then we get the final version signed in margin. The motion's been made. Is there a second?
Second.
Motion's been made and second. There being any further discussion? All those in favor say aye. Well, thank you for being here. We're going to be working on streamlining our meetings. This is the first time, so I think Mr. Real has been looking at some different options that work through our iPads, because it's possible that we're not gonna have a meeting together like this again, and you're gonna be out of your home, out of your car, out of your iPad. So he's working on getting that done. So, then there's been, changes to the Open Meetings Act that allow us to do that. So we'll work on the postings. Mayor Silvano Sanchez is here. He's been very cooperative. Mayor, I don't know if you have anything else to say, or you need to add anything, huh? And you're pretty much following what we've approved already, right? You're pretty much following what we've approved already? Yes, sir.
This measure lasts until April 3rd. If you choose to extend it, because as Mr. Mendez said, conditions may deteriorate, will you be able to renew this without having another meeting? Is that built into this?
No, we'll have to have another meeting, and that's why I'm saying the next meeting will be videoed to the public to extend it. And based on the changes that they've made to the open meeting requirements, which allows to do so.
You can renew this electronically
Yes,
with the same signature?
yes. So, I wouldn't say with the same signature, we'd probably do a form anyway, but we can make the decision electronically and have someone, email petition, and like, I get one page of Commissioner Ayala, one page of, and then you put them all together, and it's kind of like the court records. Is there, yes,
Real quick, Judge, Commissioners, if the treasurer's office does close, what happens to the vendors? Are y'all needing any payments on vendors? Like on our end, we open access accounts for the sheriff's department, fire department, and the county.
well, I'll ask, are you equipped to take, American Express?
Yeah, yes, sir.
I'll ask, Mary to see.
As far as right now, I don't plan to close the office.
You don't have to
No,
close?
sir.
Just a little reminder, we are a small business, and we are about 30K right now in supplies. So I would hate to delay you all. If the county can work with us, we are about, just in the info that we ordered, we're about $30,000.
What I'm gonna ask, we're covering the bills next, that if you have those invoices before we finish doing the bills, go ahead and do it.
Okay.
Then I'm gonna, part of the motion, authorize Margarita Esqueda and, Maria Perez to be able to sign off on the bills that come in for those services, you know, on the signature of Chief Mendez. And I'll put that in when we cover the bills. Do we have any bills today? And that's where we're at now.
And we'll continue offering our products and services to the county. Thank you.
All right, thank you. So now we're gonna proceed to our bills. And motion carries. Oh, did we vote? Yeah, we voted. Yeah, motion carries. See the bills. You want to sit here for a while? You want to preside the meeting while I go to the bathroom? The bills.